As a chiropractor for neck pain, I find there's a variety of different factors that would contribute to neck pain. My name is Dr. Matt Panetti. My office is called Prime Chiropractic. We're located here in Centennial, Colorado, and we focus on neurostructural restoration. And when it comes to neck pain, what I find is neck pain is oftentimes the superficial layer, like the tip of the iceberg, if you will. What's below it, beneath it, is something much more significant, much more severe. And because neck pain often comes and goes, most people do nothing with it. And that's unfortunate because below the surface, unbeknownst to them, subconsciously, the problem is wreaking havoc on the rest of their body. And while it might not be neck pain the next time, it's most likely something just as significant, if not more so. Now, when we talk about neck pain specifically, there's a couple different reasons why someone might have it. And again, the pain itself is the superficial layer, so I'm not really talking about that right now. I'm talking about the reason for the pain in the first place. And it could be a variety of different things. Could be a car accident that was in the past. It could have been a muscle strain or sprain. Could be a structural change with the curve in the neck or the structure of the spine below that. It could be due to a high load of emotional stress. And in the case where someone decides they want to do something about their neck pain because it's just destroying or disturbing their life in too many ways, the first thing they're going to usually do is look for somebody to get them out of pain as quickly as possible. And so if they go to, say, a medical provider, the medical provider has a couple tools in their toolbox. They might prescribe some sort of over-the-counter or prescription medication, painkillers, muscle relaxers, things like that. They could prescribe some sort of physical therapy, exercises, or rehab. And they could, in very severe cases, prescribe some sort of surgery. If you decide to go to an alternative healthcare provider, someone like, say, a chiropractor, oftentimes people will find themselves in a traditional chiropractic office where the approach, the focus is how to essentially get rid of the symptom, how to cover it up or how to get rid of it. And the way that a chiropractor does that is through typically manipulation, soft tissue work, cold laser, ultrasound therapy, things like that. And while that may provide the relief that the person is after, that is just short-term relief, quick fix, if you will. It's not lasting change. And nothing against that. It's good, it helps people, and if that's where you're at, then I encourage you to proceed and go down that route. However, if you're looking for lasting change, that's probably not going to be the best approach, neither of those. Which separates a neurostructural chiropractic office from the other two, a medical provider or a traditional chiropractor. A neurostructural chiropractor is going to be looking at the core problem, the root problem as to why that pain was there in the first place. Because while getting rid of the pain is an important piece, important for you and also important for us, your pain may be entirely due to your bad eating habits or your emotional stress or the structural change that's happened in your spine. And until you correct those problems, the pain's never going to go away for good. You can slough off pieces of the top layer and you might feel better temporarily, but it always bubbles back up again. A person who has only been dealing with neck pain, say, for a couple weeks or a couple months is going to be very different from the person who has had neck pain for years or decades. And maybe it's not consistent, it's been off and on, came and went. However, the process that's been going on for years and years is still there, bubbling under the surface. And usually in those cases, we're going to see significant arthritis, significant degeneration versus the person who's brand new to neck pain. So if you just started to feel neck pain for the very first time, now's the time to approach it and do something about it versus waiting until later. Because when you wait that long, the changes that are going to happen in your spine are permanent. And oftentimes, we can't do anything to ultimately reverse them or correct them to the place where they should have been at the very beginning or could have been. And when it comes to determining the severity of a case, one of the biggest things to understand is, was there damage in the past? Was there a car accident? Was there a hard fall? Was there a concussion? Was there damage? Second thing, how long has this been in place? Like I mentioned earlier, how long have we been dealing with this pain, or how long has this structural change been going on? Number three, how is the health of the spine? Not just in the cervical spine, but also in the thoracic and the lumbar spine, the neck, the middle back, and the lower back. How healthy is that spine? And the last component is how healthy is the soft tissue around the spine? The muscles, the ligaments, and the tendons that hold everything together, how healthy are they? Because all those come together to help us determine, one, how complicated is this case, and two, what are the likely outcomes and how long is it going to take to get there? When someone with neck pain comes into our practice, we've got 3 steps that we need to get into place. Number one, besides identifying the problem and understanding if there's a solution or a correction that can take place, number one is we've got to get mobility inside the joint space. We've got to get the segments of the spine moving again, because when they're stuck for a period of time, they start to break down. The vertebrae themselves start to break down and degenerate, which can ultimately contribute to pain and arthritis. Ultimately, what that does is it makes the spine a lot less healthy, which is going to contribute to symptoms, regardless of pain. Number two, we've got to reestablish a curve in the neck. We've got to use a fulcrum, or what we call a pivot point, to start to mold the curve back into the neck. Everyone's neck starts out with a curve. It's developed when you're born. As a baby, you start to crawl. When you're starting to crawl, you're having to lift your head up. That helps to develop the curve. And the curve is there as a shock absorber to take this bowling ball of a head and distribute it evenly across your body. Without it, we're gonna have problems. And so the pivot point that I like to use is some sort of cervical roll. Could be a wine bottle, could be a towel roll, could be a pool noodle. I'm using a cervical roll that we have in our practice. And what it is just a firm piece of foam. We're going to place this behind the neck like this and lay on our back. You would do the same thing if you were using a wine bottle or a pool noodle. Laying on your back with the noodle or the wine bottle right in the middle of your neck to act as a pivot to have your neck curve around. We lay on a firm surface, not a mattress, not a sofa, something firm like the floor. Carpeted floor is fine, yoga mat, something like that. And we lay on it for 10 to 20 minutes. 15 to 20 minutes is the best place to be, but if you're short on time, at least 10 minutes. Don't go less than 10, you're not gonna get any effects or any positive effects. So that's the second piece, the second requirement if we're going to ultimately correct neck pain. The third requirement, the last piece, is movement. We've got to get mobility restored to the tissues. And one of those ways we're going to do that is by motioning the head back and forth. We call this flexion and extension. And I recommend everyone does this 20 times every day, getting motion through the neck. Are there other ways you could do this or different exercises for your neck? Absolutely. What we found is this does as good of a job as any. It's simple, requires no equipment. You can do this anywhere you're at. Stuck at a red light, knock these out. The second thing that I want you to do, this is a 3-step exercise. The second thing is ear to shoulder. Right ear to right shoulder, left ear to left shoulder. I'm not lifting my shoulders up to meet my ear. I'm keeping my shoulders down and I'm just motioning my head. That's it. 10 to 20 times each direction. Third piece, last step, turning left, turning right. Again, 20 times is the ideal number, 10 if you're pressed for time, but everyone should be able to find a way to fit this into their schedule regardless of where you're at. Standing in line at the grocery store, picking up your kids from school, wherever you're at, you can knock these out. So that sums up what you need to understand about neck pain if you're looking to overcome it. And if you're still struggling with it, you've had it for a while, it hasn't gone away, you've tried things like over-the-counter medications, possibly physical therapy, even traditional chiropractic, and you're still dealing with the neck pain, then it may be time to look into a spine specialist, someone who focuses on neck pain specifically. And if you'd like more information, go to our website, primechiropracticdenver.com. And you can find all about our practice on our website. You can book a free consultation with us so that we can have a conversation to find out more about what you've been dealing with, what you've been going through, and a little bit more about the characteristics of your specific type of neck pain. From there, we can chart a course and get you back to the place you need to be so you don't have to deal with this neck pain anymore and you can focus on being a productive member of your family and of society. Thanks for watching. Talk soon.